when you think about some of the more indirect impacts, people often talk about things like mosquito-borne disease. So we know that climate change was predicted to change the distribution of mosquitoes in different areas.
Does that mean because the climate's getting warmer, say, in Victoria than it used to be, we're going to see things coming further down from the equator and reaching us that previously we hadn't had to experience in terms of disease and things like that? Is that what you mean?
Yeah, so that's one of the potential impacts. And what we know that mosquitoes are really interesting because in some cases it might become too hot in certain areas for mosquitoes to survive. They
Or too
might
dry.
move or too dry, exactly. So in Victoria, that might mean that at the moment you might see more mosquitoes that we're worried about that carry diseases up in the north of the state that might actually start to move further south into major population centres. Flooding is one of those things as well that we know back, for example, in 2016-17, Victoria had really significant floods up in the north of the state, and we saw the biggest outbreak of rotavirus that we'd ever seen in Victoria that year that followed the floods.
It's interesting, isn't it? Because the floods make the news, but I'm not sure that the Ross River virus outbreak would make the news except for locally.
Exactly. And it is some of these more indirect impacts might not be so obvious. Like you said, the immediate impact is visions of flooding streets and cars washing away and impacts on people's homes. But generally following these kind of events, we do see other things, particularly in the public health space. And also if you think about flooding events, if you think about food businesses, for example, so if you've got floodwaters that might be contaminated from sewage and other things that can contaminate food sources, that can get into our drinking water supplies. So some of these flow-on impacts, they're not often reported in the news, but where I sit in public health, those are the kind of things that we get very busy thinking about and working on and providing advice to the community around.